District Hospital at South Goa District Hospital was built at a cost of 450 crores of rupees. The hospital hardship beda hospital थे, but the worst part is कि दोन फ्लोर अजून वेकंट दवरलो आहाय आणि the basic necessity आमगे साउथ गोवा कित्याक काणकोण सो आमगे साउथ गोवा म्हणजे काणकोण मेरेन कोण आहा सो बेसिकली आमगे साउथ गोवा की cardiology intensive care ICU म्हणजे cardiology ICU and full-fledged cardio ward जायो कित्याक there are many other okay golden hour म्हणून आसता आणि हे golden hour काणकोणचे खंयचे ते आमगे साउथ एंड इवन टुवर्ड्स चिंचणी or थिंगसोन लोक GMC पावपाक शकनाय. Basically the state of South Goa District Hospital is so pathetic. One of my close relatives was admitted with a wound to his abdomen on Sunday. I don't clearly remember the day, but I know it was a Sunday. So basically, they kept him on a hold till evening, saying that the surgeon would come, and the surgeon didn't come to perform the operation. Then they informed the relatives that the operation will take place only on Monday after the surgeon comes. So left with no choice, they were told either to shift the patient to Bambolim or to shift the patient to a private hospital in Margao. So kind of option nine, they had to shift the patient in dead condition in the late evening to GMC. And GMC, one good thing I should appreciate, the moment he was admitted, in a couple of hours, the surgery by midnight was completed. Each patient after thing dolo into Margao hospital, that God knows what would have happened for the entire night. Whereas before 12 o'clock here in GMC, the surgery was completed. So my thing is this, the South Goa District Hospital, we should have made the best out of it. It is like a white elephant as of today. A cardiology ward is not a luxury, it is the need of the hour, it is a necessity. Okay, कितू जो life saves जावपाक शकता. A full-fledged cardio ward आसून जायो. आमी हो demand कोता request कोन्नाय. On behalf of TMC, we demand a full-fledged cardiologist and interventional cardiologist and a cardiac surgeon should be present 24/7 in South Goa District Hospital. From me, Rajan Babu will be speaking. What's the name? Mariano Rodriguez.
He is the convener of the AITC. Convener. All.
Yes.
See, आम्ही आता बाब मार्यान सांगले about South Goa district. Are whether it is South Goa, North Goa, GMC, we have observed very carefully that the health minister makes surprise visits and pulls up staff for so-called dereliction of duties. These are all professionals. Whether they are doctors, they are nurses, other paramedical staff. Firing somebody on camera, can it bring discipline? What message is being trying to tell? They are all professionals, they are out to serve people. Can a person who is being fired and humiliated and defamed on camera work sincerely to help and serve the people who go there for their needs? Are they not under psychological pressure? And I spoke to some of the professionals who were in the health department, who were in GMC earlier, and I told them he is doing a good job. They told me, something is wrong with you. He is doing this ever since the court has audited and sanctioned and censored him in the TCP department. This is the problem. Can anybody fire anyone on camera? What are you trying to tell us, that we are in a civil society or we are in a barbaric society? That you try to fire everybody in the camera and try to tell something. Now the question is that what is the reason he is doing this? Our questions. Are these pressure tactics used on professional doctors so that they toe his whimsical lines? Are questions being raised by the people of Goa? By professionals who have worked in the health department. I have asked this question. We all know how the pharmacies that are running there, whose interest it is. If it is not direct, there is a subsidiary interest in there. How they have put out the Goa antibiotics for running there. They were thrown out. And these people are brought in. Now, very important and why it is a very prominent channel has brought this news. And this news is not fake news. This news, there are enough people to suggest that it has been leaked by the Health Minister's office itself. Now, what does the news say? The GMC's cardiothoracic department, led by a senior doctor, that means the head of the department, is undergoing an audit to identify potential lapses. Audit should take place. We don't condemn that. However good, however bad. But this, what is talking of a senior doctor, I can't know, but give me who started this department, in my opinion, and saved so many lives today. Now tell me, when this is leaked out, the health minister is silent for the last 4 days. This is going on. Silence is neither denying it. What does it mean? That means those people who are saying it has gone from the health minister's office are correct. Because this is also a reputed channel. I don't put it just in the air. And there are people who have confirmed it. So question is, now tell me, what is the health minister trying? A man who is publicly shown that he is under audit, he is dealing with live patients' heart. Can you not make an error by this psychological pressure that you are putting on him? What are you trying to do? Send goons out and get some non-goons? What is the game plan? Make it public to the people, to the public. You want these professionals to follow your line? Because there is already talk saying that TCP का जो दुकान बंद हो गया थोड़ा, ये बात चालू होता है. But crores are being spent and showing that this has happened. Super facility block is there. Go and see lines are there, lines and lines. Outside picture is very good. Till this has come to our notice now. He's trying to create problems. We are living in a civil society. This is not a barbaric rule. Does he really think he's the Raja? That he's going to treat the health department staff this way? What is the use of you having all equipments and good buildings if the patient, if the people who are going to treat the patient are not in a proper mind, are put under pressure? Therefore, AITC demands that the health minister come out openly and clarify what Natak has started, suddenly going and firing everybody left, right, and center. One side, under this minister, Goa is getting destroyed. Goa is becoming a concrete jungle. On the other side, you are putting the patient's life in risk, a very sensitive department. It is floating in the air, saying headed by a senior doctor. He is under observation and under check. This is absolutely defamation. Therefore, it is very dangerous that the people who are dealing with this can create an error and patients can die. So we demand that the health minister behaves in a more sensible manner, because professional doctors have put years of service there to serve the people. And when there are complaints that certain doctors don't treat the patient well, one of the reasons is because they are under pressure of this type of minister.